Welcome to ReNew Hull's short educational video on alcohol. Alcohol is something which is widely available and is often seen as a normal part of everyday life. People will often describe alcohol as a factor when socialising, celebrating, or even commiserating. Retirement is another factor which can often impact on our drinking habits. It may become part of our daily routine and can then be difficult to give up. There may be less pressure to give up drinking than for a younger person, fewer family responsibilities, and no pressure to go to work each day. Also, social isolation, bereavement, and ill health can also lead to increased drinking levels. But did you know? Alcohol consumption is the world's third largest risk factor for disease and disability. Alcohol can damage nearly every part of the body and has been identified as a factor in more than 60 medical conditions, and it is also known to cause 7 types of cancers, including mouth, throat, and bowel cancer. Physical illness is often painful, and it can be tempting to use alcohol to make these difficulties more bearable. Research suggests that as many as 28% of people use alcohol to alleviate chronic pain. Not everyone who drinks too much will develop health problems, but the more you drink, the more likely you are to get such problems. Alcohol can have a negative impact on some medications. Side effects, including increased drowsiness, can be experienced when alcohol is consumed with prescription painkillers, sleeping tablets, or antidepressants. Alcohol can also reduce the effect of some medications, such as those prescribed to thin the blood. This can increase the risk of bleeding or developing a clot or blockage in your bloodstream. Older people typically drink less alcohol than younger people, but 1 in 5 older men and 1 in 10 older women are drinking enough to harm themselves. The more you drink, the more likely it is that alcohol will harm your health. But there are lower levels of drinking, which for most people will result in a lower risk of alcohol-related harm. To keep health risks from alcohol to a low level, you should aim to have several drink-free days throughout the week. It is also safest for men and women to not regularly exceed more than 14 units a week. 14 units is equivalent to 6 pints of 4% strength beer or cider. Many drinks now show the number of units they contain on the bottle. 1 unit is equivalent to 76 ml of 13% wine. It's equivalent to 25 ml of a 40% spirit, or 250 ml of a 4% lager or cider. As the strength increases to 4.5%, 1 unit is equivalent to only 218 ml of beer or cider. Reducing your alcohol intake can be achieved by making small changes, such as alternating between alcoholic and non-alcoholic drinks. You should also aim to spread your drinking across the week instead of binge drinking on 1 or 2 occasions. Binge drinking is defined as drinking more than 8 units of alcohol in a single session for men, or 6 units of alcohol in a single session for women. If you are unsure of how much you are drinking, keeping a diary can help. If you don't have a diary, you can just use a calendar or post-it notes, but please keep them safe. ReNew offer free and confidential support for anyone in Hull who is affected by alcohol or drugs. We also have a family team who support and help people affected by someone else's alcohol or drug use. If you would like help, or you are concerned about somebody else's alcohol or drug use, you can find advice on the Change Grow Live website at www.changegrowlive.org. For further advice or to make a referral for yourself or someone else, get in touch with ReNew. Here is our telephone number, our email address, as well as our website. We always welcome a call or an email, even if it is just to ask a simple question. Alternatively, our early intervention team are also available to answer any questions via our Facebook chat, Monday to Friday, 9 to 5 p.m. Our Facebook handle is @CGL Hull.